Give us an update on the state of the nurses at the Johns Hopkins University.
I think the primary state of the nurses is exhausted. Everyone is working incredibly hard to keep up with the patient load, keep up with the demands of using the PPE, keep up with the demands of working overtime to make sure units get turned into COVID units and patients are safely cared for. We're incredibly grateful for the work of our nurses. It's really just been unbelievable.
Lauren Sauer, what I notice about emergency medicine is you try to learn every step of the way. What do you know now about the therapeutics of this virus versus where you were 6 weeks ago?
We just conducted the first phase of the ACT trial, which is the NIH adaptive trial, and the first arm was remdesivir. So we are starting to see some positive data, which is really exciting. We're learning a lot about some of the other drugs that have been tried, hydroxychloroquine, chloroquine. We're learning a lot about proning of patients. So there's a lot of studies underway all throughout the hospital.
Lauren Sauer, talk to me a little bit about how first responders are feeling about, the president and the administration saying that they want to reopen the economy, even if it means more, rise in deaths and infections. How many percentage of the population we think have had COVID? Do we need much more testing to try and understand where the virus is and in what phase we are exactly?
Yeah, absolutely. So I think the first word that comes to mind is scared. When you're in the hospital every day and you're seeing these patients come in quite sick, and knowing that there's so many of the population who are not infected yet, and who may be as states and locations start to reopen, we get really nervous. We're finally starting to see a bit of an easing in the number of cases in Maryland, and we approach that easing with cautious optimism because, as you start to reopen, you'll see a spike in cases, and in several of the states that are already starting to ease restrictions, their cases are still on rapid increase. So, in states like Florida, Nebraska, other places where they're starting to ease the restrictions, their case counts are actually on the rise. So I think we are all in the healthcare setting nervous that these restrictions will be eased too quickly and we'll see a massive spike in the number of cases.
Do we have more drugs now? And how close are we to a vaccine to try and fight this COVID-19?
I think we're still a ways away from a vaccine. I mean, everyone is working overtime on the development of a vaccine. And in fact, there was a summit earlier last week, specifically focused on racing to get a vaccine up and running. It's a true tour de force of global efforts to develop a coronavirus vaccine. On the therapeutic side, we have remdesivir. We saw the positive data come out from the first phase of that clinical trial and several other clinical trials around remdesivir. So it is definitely looking promising. The data are looking promising, but that is an IV infusion drug, so people have to be given it in the hospital. So I think there's a lot of people working on drugs that can be given orally, drugs that can be administered at home or in the outpatient setting. So we have a long ways to go.